Everyone is muted.
We can't hear.
Okay, then I've got double microphones. Does that work now? Can you hear us?
Yes.
Yes, we can hear you.
Okay, I think I heard that. Thank you. All right, so you have in front of you, we were just talking about the numbers on the plan, a little over 12,000 employees. The current board contribution beginning July 1st of 20. If you remember, this was the board's commitment to funding and shoring up the health plan was to begin that contribution, which is an additional $40. Projected revenue increase is a little over 8.6 or almost $8.7 million. Okay, if you look, the current monthly premiums are listed and the benefits are listed as well, and those will be staying stable for next year. We're not proposing any changes to deductibles, co-insurance, or rates. And also, Polk County Public Schools has extended a number of benefits to you during the time of COVID that the board has been paying for. That has been a benefit called Teladoc, which is a national network of doctors. And the district has absorbed the cost for that. It's about $1 per month per member. And that was when the doctor's offices started to shut down, we were concerned about access to physicians during this time. We've had a lot of good feedback on that program, and we plan to continue that hopefully beyond December. But right now it's in place through December. The additional benefit also is the COVID benefits. Under the Blue Cross Blue Shield plan, under the CARES Act, we were required to cover testing and treatment for COVID at no cost. I believe that was only required to be effective through August, but we extended that through the end of December, unknowing what was happening with the COVID infection and how it was going to be impacting the membership. So that also was included through the end of December. I gave a recent report, I think, to the committee that, and actually the school board asked too. We've spent about $600,000, which really, believe it or not, is not much for COVID treatment, testing, and all of those benefits. So Blue Cross Blue Shield is tracking that separately for us. Okay, the proposal for September 1 of 2020. For you, the initial proposal. These were things that were discussed at the last Collaborative and Superintendent's Insurance Committee meeting. The first one and first two are basically what I like to call low-hanging fruit, are pretty much just easy benefits that would get us a cost savings that we're not taking advantage of now. The first one is to implement a specialty copay solutions program. And what this does, manufacturers, many of you have heard the advertisements, they also sponsor rebates through their programs, and especially for the high-priced biologics that a lot of people are taking for like Crohn's disease, arthritis. And so manufacturers offer copay maximization programs for this. And basically what we would do by flipping a switch, it takes us about 60 days to implement this, flip a switch, and our partner Alliance, who works through Blue Cross Blue Shield to administer this plan, would actually collect any premiums or coupons from the manufacturer. And in exchange for that, it would waive any copayment for the member. So what I'm showing you an estimated savings of $900,000 over the course of next year. The one thing with this that we never know is how long the manufacturer is going to leave it out there. They can pull it at any time, but it's one of those things that if you're not getting it, it's kind of like it's free money and you should be getting it and utilizing it. So that's that program. So to me, that would be very simple and seamless for the members, and I actually would love to start that in December if we could. Because to be honest, let's do it as soon as we can, if it doesn't impact the members. And it would be automatic through the vendor. The second thing I'm proposing is actually something we already have in place, and I've talked about it before, but it's a capitation arrangement with a Quest Diagnostic. Quest Diagnostic, we pay them a fee per month to do all of our lab work for us, meaning any kind of, this could be your A1C, this can be your cholesterol screening, all of your basic lab work. In exchange for that price, we send all of the lab work, like we do through the clinic, we send it all to Quest. And then it's not billed. Nothing else is billed to the member, and it's totally covered for that capitation is what we call it, or that fee we pay per month. And so what this would do is require employees to use that arrangement. What we're finding is, particularly with Watson Clinic, they are, for the convenience of their doctors, they're sending the lab work through their own lab rather than sending it through Quest. So a lot of this is going to be more employee education about the fact that you should send it through Quest, because what I understand talking to employees is when Watson sends it to their own lab, the employee gets billed. So the employee is paying costs for something we've already paid for free. And one thing that Watson has told me is they like it because it goes in their lab, it goes into all the records, and it's pretty much done pretty quickly. Well, Quest can do the same labs on a stat basis if they're necessary. It just requires it to be then keyed into the member's record. So to me, the employee is paying double for this. Yes.
So I know we had talked about this in the insurance committee. Are we going to get stickers or something to put on our insurance card so that Watson knows that they have to send it to Quest?
Well, one thing I've asked that question, and Jan, help me out here. Do you know if we got a reply back on that? Jan Bush.
Sorry about that. I couldn't hear the question. Can you repeat the question?
She's talking. Are you unmuted?
I'm unmuted, but can you hear me?
You said she was talking?
Can you hear
For
me?
some reason, I can't hear her.
Yeah. Let me try to dial back in.
So they're volume and all there and that?
I don't think so. So maybe it's a connection issue. Sometimes when I join, I don't get any voice or audio, and I don't know. So maybe she can log back in. But Stephanie, we have asked and inquired about that. A former group I was a part of had gotten stickers from the vendor, and they were able to put it on the ID card. To be honest, that's going to be hard for a group of 12,000. I am committed to working with Watson to send something out through their provider newsletter to make sure that they know about the change. Okay. So I'll work out whatever I can to make sure that that gets communicated. But to me, it's like the employees are spending money where they don't need to. Is the way I look at it. And it's going to just be education with the providers, but we can help with the large groups like Gessler and Watson, help communicate that.
So are you saying?
So that's
that
going to
you
estimate to
work-
save about $600,000 is the estimated cost in the labs.
So are you
The
saying?
third proposal is where the heavy lift is going to be this year and the change that I promised I would bring back. One thing we're finding with COVID is that people are more focused on their health. And I've heard a lot of good news over the last 6 months about people getting more engaged with the wellness coaches and or managing their diabetes or getting their health under control. Because to be honest, it has scared a lot of employees and a lot of spouses, because if you have all these comorbid conditions, your risk with COVID it's much more serious. So one thing is kind of on the preface of that to kind of build on that is to really start implementing a wellness strategy. What I'm proposing is to implement, it would be a $50 annual wellness incentive. And we would use what we're proposing right now is My Blue Rewards. It's a portal that we would have available through Blue Cross Blue Shield, where it would track the activities. Now, an activity, a wellness incentive could be anything, including You could do an annual physical. You could do a mammogram. You could do any of those things to qualify for the $50. The real crux of this is doing what they call the health quotient or health risk quotient. I've talked about before how we don't really have any health data on a lot of our employees. We have employees that are not using, maybe they're young, they never use the insurance. So we don't even have any data on them, okay? So what I would like to do is to build our wellness program, we really got to have data on all of our employees. We have to have blood pressure readings, we should have labs, we should have all those basic things. Employees should be going in for their screenings. And what I'd like to do is really put that health quotient out there to start gathering that data. Now, that data would be able to be shared with HealthStat, but only in an aggregate venue. It would not be individualized. But the idea is through this portal, they would be able to track that, and then we'd be able to get the data so that we have the full picture on the health of our employees. And that would help us then come up with solutions to help improve the health of our employees, to be honest. I mean, that's what that's all about. So we're looking at a cost there because we would have to spend, it would be $1 or 50 cents, 50 cents for the portal per employee. And then we're figuring the cost of, we're figuring maybe if 1,000 people complete it the first year, that would be 50,000. So we're looking at the total cost being $72,240, and you can see the savings there. It's still an estimated savings for the school board overall. And if you look at the two savings above, we're still showing a net savings to the school board overall with the programs. One thing that I just had a call on earlier today, we did also get an additional benefit. One more thing that we've got that's being offered for free is a nurse navigator program for cancer with Johns Hopkins Hospital, Department of Oncology. And HealthStat has partnered with Johns Hopkins, and they're offering us an 18-month program to use this nurse navigator program for free, meaning totally confidential. Anybody, including managers, fellow employees, family members that are dealing with cancer, can call this navigator program to get help with everything from navigating the sick leave bank, disability coverage, to helping to know if what the doctor is prescribing, if the type of treatment makes sense. One illustration was a type of what do you call that? The treatment that was prescribed was found to not be effective for the type of cancer. But had the employee not had this nurse navigator program to go to as a third party, they would never have known that. So they would have missed more work, and they would have introduced poison in their body that wouldn't work for their tumor.
So if it's free for 18 months, would we reevaluate with
Correct.
with the not the sick leave, but the insurance committee to see if that's something we wanted to continue?
Absolutely. I had looked at navigator programs before because there is a cost associated with most of those, because our high incidence of cancer definitely shows that's an area that we need to focus on. So this provides that support through that process through a very complex disease, and really helps employees get the support that they need. And this is the new trend that a lot of large employers are putting into place to help their employees. So we would look at it over that 18 months, weigh the good versus, do we like this compared to the cost going forward, and decide if that's something we want to continue. We could always change vendors because there's other vendors out there for that type of service. But this just kind of fell in our laps. And with Johns Hopkins being such a wonderful name, having a good story behind that, and the partnership with HealthStat, it was just a natural fit. So that's the proposal. Any additional questions? Something else I was supposed to cover? Jan, did you get back in?
Can you hear me?
Miranda has her hand up.
Oh, okay.
Go ahead, Miranda.
Okay, back up to the specialty copay thing.
I can't hardly hear.
Okay, let me turn my volume up.
Oh, wait, I got you. Yes.
Okay, on the specialty copay solutions. Okay, like currently, the manufacturer of my biologic pays part of my copay, and I pay $5. So what you're saying is that somehow through Alliance, that would get paid?
Yes, what happened, Lorinda, is your copay would be waived. And you would, instead of, from what I understand now, the help sometimes is coming through reducing your out-of-pocket maximum. So the cost would come back to the health plan. So you would have a zero cost for that.
Okay. That's, take my hand down.
Linda, can you hear me?
Yes.
So basically, the plan would benefit from the incentive that the manufacturer provides to be able to promote their drug. Right now, today, the plan doesn't benefit at all by the manufacturer incentive. But when you implement this program, if it's $1,000 a month incentive, that's what the plan's going to save. And the member has a zero cost share, zero copay.
Okay, thank you.
Mm-hmm. And I'm sorry, I was on the line, but what was the other question, Linda, that you asked me?
I was asking about the sticker. Remember, we had talked about a sticker for the cards, for employee ID cards, because those would not be reissued. But if we could somehow get a Quest sticker to put on the back of the ID card.
Yep. I haven't gotten an affirmative on that, but I'll follow back up with Blue Cross right now.
All right.
And Linda, I don't know if you wanted to mention the DCAP.
Yes, thank you for the reminder. I knew I was forgetting something. One thing we're struggling with this year with COVID is we have a benefit for dependent care under the flexible spending accounts where people can set aside daycare money. And what they do is they have to put aside the amount this week, and they get it then after they've deposited. And what they're doing is they're getting the tax advantage, the tax savings. Instead of claiming it on their taxes, they're getting the tax savings during the year in their paycheck. One problem has been COVID hit. So all the people that had set aside dependent care money, all of a sudden were saying, whoa, wait a minute, I need that money. I don't want to have the deduction anymore because my daycare is closed. So with the uncertainty surrounding, the problem is I can't allow them under the plan rules with the IRS to carry over that money into January. So we have stopped the deduction for all the people that called and said stop it. And what I wanted to propose for 2021, just because of the uncertainty still with COVID, is to not offer it and suspend it for 2021. We had 80 employees total participate. So I don't see it as a large impact. I see it more as a you know, if you do daycare in 2021, because nobody knows what this looks like. It could be another year out and about. So the thought was for 2021, they would just use their tax filing as that solution rather than the dependent care account. And that way, if they are spending money, they don't have to worry about stopping a deduction, starting it, getting a refund, which we're really not allowed to refund any money under the plan either. So that's where it becomes difficult. So I'm still waiting to see if the IRS proposes any changes for that, but they have not. So my thought was just to suspend in 2021, and then we would evaluate again in 2022. Hopefully, if we got a vaccination and this thing's gone, you know, then it'll all be good, and that way we won't impact employees. So thank you, Jan, for that reminder.
Linda, how would employees do this?
What I'm planning on doing is doing a mailing this fall to all the 80 that are participating to let them know, you know, where we are. If they have any current money in that, please spend it, hopefully this fall. If they have any daycare going on, I'll see where they are, try to work out. Hopefully people don't have large balances remaining. Most of them I think we shut off. And then what we would do is just tell them that we won't be continuing, but they would use their taxes for the following year. So that's my plan, is to do a direct mailing to them.
Mike, can you talk a little bit about where you guys are at, where you think this projected revenue increase is going to come from with the contribution going up? Are you wanting to come out of the additional $40 from the big student allocation that we got this year, or are you going to look to find somewhere else to get it?
I'm sorry, what?
So on
This-
page 1, where it says funding proposal, we're increasing the board.
Remember where we had
contribution.
dedicated the $60, Mike, and we had committed, the board had committed to that?
So is that coming out of the additional money we're getting from the base student allocation, or are you guys trying to find it in other places? Where,
I'm confused from the 60 to 20 you're talking about.
so the 734 is an increase from what we had signed up last year.
Yeah, that's 100% board.
I know, but the money's it's gotta come from somewhere, right? So where are you guys, are you wanting to pull it out of the general fund?
Yeah, it was budgeted on the line item.
Okay,
During the budget process, we have always had the $60 and a $9 million.
okay, so that's part of that
5 years.
9 million from last year, so that's not new money then, it's already been planned.
You know, it's new money this year, but it was planned for 5 years. We were, in order to get our plan back to where it was, the board said they'd go on a 5-year plan
Okay.
of adding 60. That's what we project.
Mm-hmm.
Now, we may get there earlier,
Mhm.
and then we would go from there.
Okay.
So I have a question. Can you hear me?
The alliance, we would not be changing any of the medicines or losing any or gaining some, or would we be doing that?
Well, just so you know that the formulary is the same formulary, but it is updated every quarter by the vendor as a part of just regular, as things are introduced or go generic or additional things are approved. So that is a constantly changing process, but the formulary itself will be the same one, but it does get updated quarterly. So that can change.
Okay, and one more for the Navigator program, to input the information, the doctors will be inputting all that on top of us accessing other information on top of things too, correct?
Okay, the Navigator program is totally confidential and separate from the medical program.
Okay.
So employees would participate on their own confidentially. And there would not be any data shared between other than what the employee releases to Johns Hopkins
Okay.
and involves them in. So there would not be any data sharing really between that. I think we would get numbers on participation, but we would not get obviously any detail because that's confidential.
Thank you.
Mary Ann?
Can I go back to the Quest piece again, please? Just a quick question.
Yes.
Is the plan for Watson Clinic or any provider to ask the Polk County School Board employee whether they want Quest Lab or their lab, or because the problem is you are not really, when you go to Watson, you're not really given any choice, or there's no place where you can notify anybody really. The doctor fills it out, you walk down, they check you in and give you a number. So I'm trying to figure out how the employee knows, or if we're going to make Watson part of having to ask that as a preference. What is your preference?
Well, one thing I would suggest, and that's why we were looking for something for the ID card, is they always ask for a copy of your ID card, right? They ask to see that every time you come in almost, or every year. They ask to see that, right? Once a year.
Once a year they do. They update
Okay.
once a year.
So this would change in January. So that would be the time you're normally there at the front desk anyway, giving them your card. So that is something I think the employees have to learn to be advocates. I'm not saying that I'm not going to work with Watson on the backside to tell them, but I think the employee has to learn to be an advocate too and just ask and say, just because they'll see hopefully a sticker on there or something, and they'll see, please make sure that my labs go to Quest. Okay, so it's just a simple statement, but it's where the employee can get involved in their care and at least mention that when they visit after January.
Okay, and then just to be completely, because I was having some trouble with sound for a minute there, the new program, the health risk assessment, if you will, that's all voluntary.
Yes, ma'am, it is.
Okay. Thank you.
Oh, okay. All right, open enrollment. We're getting prepared for open enrollment, and this year we are doing virtual meetings. rather than in-person meetings. So we're working very closely with, we're using the same system that teacher recruitment uses. And we're working on setting those up. We have 2 meetings, and I just approved a postcard that'll be mailed out to employees' homes. So please have them look for that, and we'll announce virtual meetings. I'm excited about it because we're going to have each vendor that's going to have a booth. We're going to have some giveaways, and I've forgotten the times, and I don't think I brought them with me. So I'll have to get that back to you, but there's one in September. And there's one on a weekend, on a Saturday morning. I just don't remember the date.
What are the times?
For the record, this is Tedra. For the
Yes.
record, that system is Brazen. And just for Stephanie, it's the same system that we used for the teacher transfer fair earlier. That was really easy. It's pretty intuitive and easy for our employees to utilize. So there is already some familiarity with it if they did attend the transfer fair, but that's what it is. It's called the Brazen recruiting system, which has allowed us to do all recruiting virtually.
Okay. Wait, hold on. I had a question in my head. When are the dates? Do you have the dates for open enrollment?
No, I will text right now and get those for you.
Are things moving online as well, as far as the open enrollment forms, or are we still having to do paper ones this year?
Okay, it will be paper again one more year.
Okay.
I am working closely with Jan to look at automated systems. I've already saved enough money in other programs that I've done this year to pay for an enrollment system. So there's not going to be any net cost to the district to do that. I am evaluating like 4 different systems to look at cost and function to see what's going to work best for us. Because the hard part is going to be communicating back and forth with payroll. But it's going to be it will have then, it will be a web-based site and may or may not have mobile functionality. That's one of the pieces that's different in some of the offerings. But the nice thing is that what's really bothered me about the pandemic is employees can't get any information on what their enrollment looks like other than looking at their paycheck. So it has really hindered us from being able to provide service and for them to be able to access information and even do status changes and things of that nature. So we are committed to hopefully purchasing a system and getting it underway in early 2021. So
Ms. King,
And we've got 4 pretty competitive proposals for that we're evaluating.
yes, Jan has been helping me with that analysis.
so it will still be through the portal, and you have to print the forms and stuff.
Correct. We will be loading the current elections into the staff portal. So the employee will be able to see their election from last year. And then they'll be able to, I've simplified the enrollment form because I had a lot of problems with the enrollment form last year. So we're simplifying that. It's just hard to do paper. It's very hard for a group this size. And you miss things. We can't read the handwriting. People swear they sent it. We can't find it. So we will still have a QR code that will register in when it's received. But next year, I'm hoping to have a full-blown system, and they'll be able to go on there and make their elections.
Will there be some sort of like a hotline employees can call, for lack of a better term, some sort of a hotline employees can call and verify that the forms are received, that they're being processed, those sorts of things?
We do have we have an email right now, and that's pretty much where we're limited. We can, create an extension, but I have a group of basically 3 people, and then I'll add 2 more staff to help supplement the regular benefit staff. Sure.
And some of the vendors have an optional call center that you can also include.
Jan, I'm sorry, I can't hear you.
I'm sorry. Some of the vendors have an optional call center that you can include.
Okay, that'd be great. Thank you.
You still need the paper in the office. You can't see
Correct. Unfortunately, we're still on paper, yes. One more year. If COVID hadn't hit, I would have been ready to go.
Larry has his hand up.
Yes, Larry?
Hey, I just wanted to make sure that you said that it won't be a mobile app because most of my people don't have computers. They do all their stuff with their phones.
Yeah, I'm looking at that analysis now, Larry. That was one of the criteria. So one of the lower cost ones, I don't think had a mobile function. Of course, it doesn't mean you can't view it in still the web service that would be on your phone, but it may not be as crisp, and be able to auto size for the device you're on. So that's just one of the things that in the analysis that we're looking at that Jan's helping me with. I do want a mobile option, to be honest, but it depends on how much more it's going to cost me for that.
Okay, because I know most of my people are going to most likely use their phones to do whatever they got to do. I know a lot of my maintenance guys, they do everything with their phone. They don't have computers.
Yeah. Well, even those of us that have computers, to be honest, use our phone for a lot of things. It's just quicker.
Will those bids come through the insurance company?
I'll be glad to give you an update on that. It will be presented to the board. And we'll be doing, probably it's been several months since we looked at, because on the last ones, I did internal meetings with payroll and IT to make sure, because they're partners that have to support us. So I can see with maybe the next couple of meetings, if you all send you an invitation, if you'd like to take a look at what we're proposing to get some feedback. For next year, correct.
And Linda, if you want to send over flyers or something for open enrollment, we can get them in and try to help get that information out to you.
Okay, that'd be great. I also want to send you one on the Work Strides program too.
Okay.
Other questions for me? I'm asking for OE dates. Give it to me.
Have we got a proposal from your folks?
For salary?
No, to help the plan.
You're waiting to see what you guys.
Okay.
Yeah.
I should ask first, when do we need everything done by for, if there's any plan changes?
Well, to be honest, we're working on communications right now. I talked to Larry because his group, we usually do a, printing for. And when I was trying to limit it to, and I know he promised to take it back to the Z board so you all could, analyze it, was just to do a flyer, really, along with the rate sheet and a blank form this year rather than a full book. Says nothing's really, quote, changing. And that way we can emphasize, if you do adopt any of these recommendations, we can just focus on those programs and communicating things like the importance of the beneficiary. That's another thing we want to make sure that gets out there again. A lot of people have filled one out, but there's still probably need to focus on that as well.
So, I mean, and just going through here, unless I'm thinking, it doesn't look like really much is changing.
No.
No, we didn't know you were planning on changing, so, but if that is the case, I don't even know if we're past that point, Linda, or not.
Well, to be honest, we're pretty close because, I need to get printing probably in the next week or so. I mean, otherwise I'm sitting there assembling them myself. So, and, but otherwise what I do plan on putting is just putting everything on a dedicated website so that employees would have that website to go to, because that's much easier than making copies of things. Okay. And to be honest, the loading of the elections, the staff portal is going to be simple this year. Zach's already prepared for that. So that will be pretty simple to get accomplished.
So we'll talk as a team over this proposal, and we'll make sure that Zachary and us are on the same page too. And then we'll, Neil, we can probably get resumes.
I would appreciate it, because this time's of the essence, especially for planning the virtual fair, which I think is in maybe 2 to 3 weeks. So we need time to make sure we bring in the right people and talk about the right topics. Okay, open enrollment is from 9/28 to 10/16. So 3 weeks. So I'll now ask fair dates, the enrollment dates. Virtual. So that's pretty much, so that's only in like 2 weeks. So the first open enrollment virtual fair is going to be 9/29 from 3 to 6 in the afternoon evening. And we're going to kind of probably commandeer this room, a few of us, so we can manage it virtually online. And then the next one will be 10/10, 8:30 to 12:30 in the morning. That's a Saturday morning. And we're gonna have some giveaways and some other things, so I'm looking forward to that. I think it'll work out really well.
I'm team. You guys have any other questions?
That's where Larry's feeling.
Oh, I already saw his bandage. And I talked to him, Larry. I'm glad you're doing better. You look like you're doing better.
Concerned about your age. What's wrong?
He fell, hit his head.
Busted his head on his truck bumper, and ended up with 7 stitches.
Oh, my
Thank God he had
Yeah.
people nearby, so.
Yeah.
Yeah, that's why I got my hat on. I don't want y'all to see my head and just focus on it.
Oh, sorry, I couldn't hear you.
So that's why I have my hat on. I don't want y'all to just focus on my head.
I was about to text him and ask him why he have on a hat.
That's why. He doesn't want to distract us with his head bandage. Yes.
You said all the health information for those days was going on the postcard form
Yes.
to notify?
Yes. We are asking people to try to pre-register, just so we have a general idea on how many are going to attend. That does help us as well.
Mrs. Porteous, any questions?
What was the question, Laura?
Did you have any questions for Ms. King or the team?
You put it on the spot.
No, not at this time.
Okay.
We will adjourn the meeting, and the unions will get back with us about their response to the district's proposal offered today. The meeting is adjourned. Will everyone please hang up fully so that the recording will stop? Thank you.